Navigating the health and social care system can feel challenging at the best of times. If you're in a mental health crisis, this challenge is considerably amplified. If you're a non-mental health professional trying to support this group of people, the work can feel really daunting. So we've made a series of films of 4 different mental health crises. Each of the films takes the patient from the home to the emergency department to demonstrate the clinical pathway. They are not meant to be perfect pathways or perfect interactions. They are designed to create food for thought about what it might be like to be the patient or the carer. The films are about 20 minutes long and have been designed to be used in a variety of settings, from the classroom to the individual learner in front of a computer. We've posed a number of questions and issues to help you think about the case, which means the session will take about 90 minutes.
Hurry up.
Hello, is it you we're here to see?
No, it's for my friend. I don't know what she's done, but she's in here.
Okay, can you show us the way?
Yeah, okay. She won't let me in, though. She's in here.
Do you want to tell us what's happened?
Well, I don't know what's happened. I know she's taken something, but I don't know what.
Has anything like this happened before?
Yes, it has.
Okay, what's your relationship to the patient?
I work with her.
Friend?
Yeah, she's my friend. She texted me this morning. She said that she'd done something. She just said sorry. I knew she'd done something, that's why I called you. She's upstairs, but she won't let me in.
Okay, have you spoken to her?
I've tried to, yes, but she won't unlock the door.
Does she know that we're coming?
Yes, yeah, and she was really angry and she won't let you in either. She told me she won't.
We'll try and have a conversation with her.
Her name's Eva.
Okay. Do you want to show us the way then?
Yeah, okay. It's up here.
Okay. You want to go first?
Yeah, up here. Eva,
What?
let me in. It's Natalie.
No, I told you not to call them and you did.
Eva, I just want to help.
You don't want to help. You
I
just
do.
fuck off like everyone else does. Just fuck off.
Come on, Eva, let me in.
No.
We're just here to help you. Come on, you've got to let us in.
I want Dean.
He's not here. Come on, you must let us
He doesn't
in.
want me.
Oh, come on, Eva.
Just go away. I'm fine. I've done this before. I know what to do.
You don't. Look, you need help. You need help. Can you talk to her?
Yeah. Eva, my name's Lottie. I'm from the ambulance service. Can you let us in?
No,
Why not?
I'm not going there. I'm not.
Fine. We don't need to talk about a hospital for the moment. We just want to know what's happened.
You're gonna make me go there. I know you are.
We're not going to make you do anything that you don't want to do. Can you just let us in?
No.
We just want to talk to you, Eva. We're here to help you.
Come on, Eva, open up.
Eva, can you let us in? Do you want to tell me what's happened, Eva?
I had an argument with my boyfriend, Dean.
What was the argument about?
I don't know, he just left me.
That's obviously upset you a lot.
He doesn't want me anymore.
Okay. What happened after he left?
I had enough. I just took some paracetamol.
Are they the ones on the side? How many did you take?
I don't know, a packet,
And what did you take them with?
some wine.
Is that all that you've taken? Did you take them with the intention to end your life?
No, I don't know. I just had enough. I've had enough.
Did you think about what might happen if you took them?
No, I just didn't want it to hurt anymore.
Come on, Eva, this is really serious. You've got to go to hospital.
you called them. I didn't-
Yeah, but you've got to go to hospital.
I
We've got
don't
to
need
make you
to
better.
go. I've done this before and I was fine.
No, you're not
I
fine.
was fine.
She's not fine, is she? She needs to go.
Eva,
You
you're
need to go now. Come on.
Natalie, if you just want to just inside, just for a minute, I just want to have a bit more of a chat with Eva.
Okay.
Have you done anything like this before, Eva?
Yes, she has. 6 months ago.
Was that after you had an argument with Dean?
Yeah.
Okay. Did you take paracetamol last time?
Yeah.
And what happened after that?
I was fine. I went and I was just standing around for ages. I just want to stay here. I was fine. They didn't need to do anything.
So, you don't want to come to hospital?
No,
Why is that?
because I'm fine. I just want to stay here.
Did you have a bad experience last time you went to hospital?
But it's just a waste of my time.
Do you understand what might happen if we leave you here? With the amount of paracetamol you've taken, there is a chance that you could die. Do you understand that? Because what we need to do is take you to hospital to check your blood and see how much paracetamol is in your blood and whether it's done any damage to your insides. We can go to the hospital that you'd like to go to, if that makes it easier, it makes a difference to your choice. Does that sound good to you?
Come on, Eva.
Yeah?
I just want to help you.
Do you want to grab the stuff that you want to take? And there's no hurry, so take your time, okay? Okay. Brought you Eva Parker, and she is 20.
Oh, I know. She's the PD patient, isn't she?
Yeah. She's taken an 8-gram overdose of paracetamol this morning at 4 o'clock. She's taken that with some wine. She said she didn't take it with the intention to end her life. She wasn't really sure what might happen. She was a little bit reluctant to talk to us at first, a little bit reluctant to come with us to hospital. But when we explained to her that if we leave her at home, she might die, it seemed to hit home with her, and she's come with us quite happily.
I'm not surprised. She did this 6 months ago.
Oh, okay.
Was it the boyfriend again?
Yeah, they had an argument.
There you go. That's fine. I can see her now.
Okay, thank you.
All right. Thanks. Hi Eva, I'm Matt, one of the A&E doctors. You might remember me from last time. How are you feeling?
Okay.
Okay. Could I ask your name?
Natalie.
Okay, and what's your relationship with Eva?
Well, she's my friend. We work together. We work in the same dress shop. I'm the manager.
Okay. And Eva, you happy for Natalie to be here with us?
Yeah.
Alright, so I understand you took some paracetamol today. Can you tell me a bit more about that?
I just had enough.
And how much did you take?
I don't know. Maybe, I don't know.
And how much is in her packet, Eva?
About 16 normally.
Yeah, maybe that.
16 tablets of the 500 milligrams, is it?
I don't know, yeah.
And why did you take it, Eva?
Felt like it.
She sent me a text to say she'd had enough. And she was sorry.
And what did you think would happen?
Didn't care, I don't know.
Eva, I just have to ask you these questions, okay?
You wouldn't understand, so what's the point in asking all these questions? I don't get
wants to
why
help.
he wants to know all these things.
They just want to help.
And how are you feeling now, Eva?
Fine.
Alright. Well, look, we need to take some blood tests, have a look at the paracetamol levels in your blood, And I'm also going to need to get one of the psychiatry doctors to come and see you to talk about what happened. Okay. Alright, we'll be back to see you later.
That's better. I think it's for the best. I know it's been a long time, we've just got to wait. I know.
Sorry to disturb. Hello, is it Eva Parker? And Natalie, I understand. Eva, my name is Dr. Emma Brodie. I'm one of the psychiatry doctors. First of all, I want to apologise. I know you've been waiting quite a long time.
Yeah, I was getting pretty fed up.
Yeah, it has been a long wait, actually.
I'm really sorry about that. I've been asked to come and see you because I understand that you've been having a really difficult time.
Yes, it has been very difficult for her.
Yeah, and I can imagine for you as well. And I just want to speak to you, perhaps find out a little bit about what's been going on and how best we can help you. And I was just wondering, perhaps we can have some time alone, if that's okay with you, so we can explore a little bit about what's been going on.
How do you feel about that, Eva?
Yeah.
Are you sure?
Is that okay? Okay, and then Natalie, perhaps you can get a coffee or something, just so if I do need to speak to you a little bit later, you can be around, if that's okay.
I won't be far away, okay? See you in a bit.
I thought it would be a good idea if just you and I had a talk about what's been going on. And I have gone through your record, so I know a little bit about your difficulties. And I do understand that you came in today by ambulance after taking 16 tablets of 500 milligram paracetamols, and you'd had a bottle of wine with that as well. But I just was wondering if you can give me a little bit of an idea what was happening when you did do that.
I don't know, I just had enough. I was just fed up.
Okay. And were you at home at that point?
Yeah.
And was anyone with you?
No, not at that point, no.
Okay, and prior to that, what was happening last night?
Dean, my boyfriend, was over.
Okay. And did anything happen with you and Dean?
Yeah, we had an argument.
Okay.
Yeah, I guess.
And then he left?
Yeah.
Sounds like it was quite difficult. I know this is difficult opening up to me. It's the first time you've met me, but it's important that I can find out a little bit about what's been going on, just so we can see how best we can help.
Well, yeah, I got fed up, and that's it really. I mean, we're fine now, so yeah, it's just in that moment, I guess.
Okay, so it sounds to me like it was quite impulsive. You weren't... Is that right? Were you thinking about taking the overdose?
Maybe. I don't really know. I just did it.
Okay. And then what happened afterwards?
Natalie rang the ambulance, so I had to come here.
And how did Natalie find out?
I must have texted her, I think. I texted her just saying, I've had enough. I'm fed up.
I'm glad you did that. So it sounds like Natalie is a good support for you.
Yeah, she's a good friend.
That's good. Anyone else that you feel like you can speak to?
No.
Who do you live with?
Just 3 other, 2 students and 1 girl works in a bar.
Okay, and are you friendly with them?
Yeah. I mean, I wouldn't say we're best friends or anything. I just, yeah, they're nice.
Do you feel able to talk to them when things are difficult?
No, I don't see the need in that. I don't.
Okay. And what about family? What's your family like?
I don't really have much family.
I'm sorry to hear that. Do you have any siblings?
Nope.
And your mum and dad?
My mum, she's not really a mum. She just don't really bother with her. And no, I don't have a dad. Not that I know.
Okay. But Natalie sounds like she's very supportive.
Yeah.
Okay, well that's very good. Besides tonight, have you done this previously?
Yeah, a few times.
Can you tell me a little bit more?
I don't know, about 6 months ago, I think I came back in, a couple of years ago maybe.
Okay, and were those overdoses as well?
Yeah.
And what was happening in those times? It sounds like there were 2 before, is that right?
Yeah, I think so, yeah.
Okay.
I just fed up, everything was too much, and I just, that's my reaction, that's just where I go.
Okay.
That's what I do.
And were you having a fight at that time, or can you remember what was going on?
Yeah, maybe, an argument, probably.
Okay. Did you have to be admitted?
No.
And any other self-harming or anything like that?
Yeah, I cut my arm sometimes, just scratches and stuff.
How old were you when you started doing that?
About 16 maybe.
Okay. And what would you use?
I don't know, bowl tops and scissors. Just, I don't know, when I was stressed, I guess.
When was the last time you
No,
self-harmed?
Not for a few months.
Not
no.
for a while?
No.
Okay, well that's good. And previously when you have done that, have you ever needed to be sutured or anything like that?
No.
Okay.
Eva's mother was emotionally unavailable for her as an infant, so she feels unlovable as a result. But she continues to seek out love, even though she's always waiting to be let down. So when she is let down, for example when Dean walked out, it's catastrophic for her. She has no tools to manage this other than not to want to exist. So, was she attention seeking? Perhaps, but don't we all need attention? On a system level, the NICE guidelines for self-harm clearly state that every patient should be treated with dignity and compassion, like any other patient. On a personal level, Eva's worldview is that it's not a very safe or kind place, and so each time a professional meets her in crisis, if they treat her with compassion, it can start changing her worldview, bit by bit. Eva is used to being in emotionally abusive relationships, and the emergency department can be just another one of those that she's trapped in. People self-harm for lots of really different, very individual reasons. Some people might feel that they want a stigmata, something to represent on the outside of their body how much pain they're feeling on the inside. Others may want to just convert emotional pain into physical pain because it's easier to deal with. Or they may want to numb the emotional pain. Whatever the reason, they're really individual reasons and they serve a purpose. Next time you see somebody who's self-harmed, rather than making an assumption about why they've done it, why don't you ask them?
Now just to go back, I know that you are with the community mental health team.
Yeah.
Yeah, when is your next appointment with them?
I think Tuesday maybe.
Okay, well that's good. That is good. And if we think about how you're feeling at the moment, what do you feel about the fact that you took the overdose?
I don't know, I think I was just fed up and
Okay.
yeah, fine now.
Do you think you took it with the intention to die?
No.
And any thoughts now about wanting to die?
No.
Any thoughts about self-harming?
No.
Oh, okay. So what do you think, what do you think might have changed?
I don't know. I guess I feel relieved. I feel good now. Yeah. Things are fine. Dean's coming back tonight, and yeah.
Okay, so it sounds like you feel safe to go home?
Yeah.
Because to me it sounds like the fight with Dean was very stressful, and need to think a little bit about how we can keep you safe even if you do have further fights with Dean.
Yeah. I'll think about it. Yeah.
Well, it's something that I'll definitely write to your community mental health team to let them know that you were here. And have you ever tried mindfulness or any type of talking therapy as a way to think about what helps and better coping mechanisms?
No.
Is that something you would be interested in doing?
Yeah, I guess. Yeah.
Okay, because that's something I would want your team to explore. I know a lot of people with your difficulties can really benefit from that. What do you intend to do once you do go home?
Just gonna, I don't know, get some dinner on with Dean, maybe, I'm not sure.
Okay.
Yeah.
And I guess if things do feel overwhelming at any point, there are crisis numbers, and I've got a card for you here. This is 24 hours a day that you can phone, and there's always someone there. So if you are in crisis and you feel stressed or you've had a fight, there's always someone at the end of the line, or you can come back to A&E as well. I think you've been very fortunate in terms of the paracetamol, but sometimes people can accidentally really harm themselves with that in the long term, damage their liver, and sometimes actually die from it. That's something we have to think about as well.
Yeah.
Yeah?
Yeah.
Okay. Do you have any questions for me?
No.
All right. Okay.